Hi, everybody. It's Freeman-Similien, SRN again. And I wanted to do a really helpful topic for people because one thing that I really struggled with when I was a new student at clinicals and a new student nurse extern at my job, I really felt awkward. I felt like I didn't know what to do. I felt incompetent. I felt like I was just standing there and looking stupid. And for me, I hated every minute of it. I dreaded it. I don't like looking like I don't know what I'm doing. I don't like just looking like I'm just standing around. So I just wanted to help anyone else who is experiencing this on how I combated that feeling and how I made myself useful to the nurses and the staff members that I actually have to work with when I'm either a student on a clinical and I'm a visitor or actually an employee on a hospital unit. So first, I want to talk about what I did at clinicals. So when I first started clinicals, of course, you would go in, most of the time, like you'll have people who you're familiar with from your lecture classes who you carpool with to go to clinical. So, you have people to talk to the night before of all the jitteries and the nervousness. But when you get there, your instructor will usually tell you what to expect. But for us, we're there for 6 hours. So even though there's things to expect, there's like 6 or 7 or up to 10 other students besides yourself. So, the instructor has to go around. So when the instructor is going around, you kind of like stand around or you try to look busy, but people can tell when you're just sitting around trying to look busy. So for me, it made me feel so awkward. I hated it. So what I would do was first, I had to come up with a plan and I did it at home. You know what I mean? I'm like, look, when the instructor is not with me or if I'm not passing meds with the instructor or if I'm not doing my head to toe assessment or whatever, or after my head to assessment, this is what I'm going to do. Like I wrote down my plan of what I would do the next day. So in clinical, first of all, you want to offer your patient AM care. Some patients that you have might be a 1 or 2 person assist, meaning, that you have to help them up and out of the bed. They can't do it on their own. So, they might need help with AM care. They might be able to still wash themselves up, but you might be able to help them in certain ways, like wash the bottom of them, or you never know, wash their back or whatever. So you offer AM care to your patient, and then you perform those duties when you agree with your patient what time they want to wake up. So, like, if you have this planned, you won't look so incompetent. You know what I mean? Like, you already have this plan. So when you go in, whatever your instructor tells you you're going to do, yeah, you're going to do what she says. Of course you're going to do what he or she says. But you're going to also have your own plan of what you're going to do when she's not around. And that is going to make you feel like you're learning more. That is going to make you feel more comfortable talking to patients. And it's just going to make you feel more useful on the unit. You don't want to just feel like dead weight. Well, I know I don't like it. I hate not knowing what I'm doing. So that's what I did. I wrote down my plans. Okay. Another thing about clinical, the nurses are busy. And nurses on day shift get students all the time. So you're not going to be the first or the 100th or, they get students all the time. So they can't answer all of your questions. So do not ask a lot of questions. Only ask questions that need to be asked, important questions. Or if they use a term, something that they could quickly tell you what it is without taking too much from their normal routine of that day. So I do see students make that bad choice where they're just asking them all these silly questions. And like I could tell the nurse is bothered by it. I don't do it, and I actually learned not to do that from watching other students doing that. So that is another thing. Okay. Another thing, sometimes you have to ask the nurse something. Like you have to talk to the nurse, and sometimes they're not so willing to teach you when you're on clinical because, they don't feel like being bothered because they're so busy with what they're doing that, they don't have time for whatever you're telling them. And plus they have 10 other things and they're prioritizing all of the things that they're doing. So be very, very mindful of that. So when you do interrupt them, apologize for interrupting them. Be very humble. Never give an attitude. What I do when I'm at clinical and I need something from the nurse and I can't because I like to make their load lighter. But if I need them for a second and I have to ask them a question, what I like to do is I just apologize for interrupting. Like, I'm so sorry for interrupting. I know you're busy. Even just saying that already makes them feel better. You know what I mean? However, where is such and such, so that you could just tell me where it's at. This is what I do. I like, listen, you could just tell me where it's at and I'll get it. I just don't know where it's at. Or whatever. Like, I'm not trying to be a burden. Just having that humble personality when you approach the nurse, it kind of eases them off from being too harsh on how they speak to you, how they talk to you, how they communicate with you. Okay, so you want to continue to be an independent entity in clinicals. You don't want to be like a burden. You don't want to be someone, an interruption. You don't want to be that. You want to be someone who's growing, who's learning, and you're helping. So I hope those things will help you for clinical. Now, when I started my job as a student nurse extern, we went through orientation and training. Okay. I don't mean to laugh, but they ain't teach us how to do our job. They did not teach us how to do our job. It was crazy. Like, yeah, we went on a unit and they sent us to our unit for the day and we learned. No, they did not teach us what we were supposed to do. Like, it wasn't the job's fault. I just think that's just how it is when you work in a hospital. Like, you learn as you go. But for me, I have anxiety. I did not have time for that. Like, I felt so stupid. I felt incompetent and I hate it. Like, once again, I hate it. And this time I felt even worse because I'm getting paid by the hour, and where I work, I get paid pretty good. So I felt really bad not knowing what to do. Like, when I first started as a nurse extern, I didn't even know that I was supposed to get report from the nurses. Okay, so I worked for like 2 weeks and I was literally not getting report from the nurses. So how was I know? Like, I didn't know what I was doing. Like, I did not know what I was doing, and I felt like an idiot. So what I did about that, I took matters in my own hand and I taught myself. I seen that the other patient techs or the other CNAs, which I'm doing the same job as them, I seen that they knew how to reposition patients. I never learned that in nursing school. They didn't teach us that. Mm-mm. Not in RN. They didn't teach us how to reposition patients. And it's really simple and it's really, really easy. But if you're thrown on a unit and you have to reposition patients, or you think you have to reposition patients, and then you're like, oh, I have to reposition patients, it's like, how do I reposition a patient in a room by myself? I didn't know. And I know it sounds silly probably to people who know how to do it, but I didn't know. So I literally went to YouTube and I typed in how to reposition patients, and I typed in how do you do it independently, and that's how I learned. Like, because I would go in and try to reposition the patients, but some of the patients couldn't help me. Like, a lot of the patients who needs to be repositioned, they can't move by themselves. So, I was like, oh my God, they have this thing they call a draw sheet under the patient. I was lost. Whatever. I just was a hot mess, but I went on YouTube and I taught myself because I did not want to look simple. And also, like, one thing that some of the nurses yelled at me about was like, she's been wet. You didn't change her. I don't know how to change people. Like, you know what I mean? So I YouTube that too. So word of advice, YouTube it. YouTube it. YouTube whatever you need, to do. Just YouTube it, because that's what I did. And it made me a better nurse extern for it. You know what I mean? Things that I learned in the computer, I easily learned that on the unit from other techs or CNAs. They taught me that. That type of stuff was easy. But it was the actual nurse assistant work that I didn't know how to do. Yeah, I know how to bring you juice. Yeah, I know how to make a bed. Yeah, I know how to do AM care. But as a nurse extern, you're not doing head to toe assessments. You're not doing the things that you do in clinical. So it was like, so that's how I did it. I YouTubed it. So you can do the same thing. Whatever you want to ask a question, any question you have in your head, put it in YouTube, and there should be some type of video. The ones that I've seen, I'm not so sure of the subscriber, but it was like, for CNA schooling videos. I looked up those videos. I'll actually share that link so that I give them their credit. But those videos was very helpful. It was like how to reposition your patient, how to change your patient, How do you change your patient by yourself? It was great. And after that, I was like, I can do this job now. So also I float, so I can be in any unit when I'm actually floating and I'm not bid shifting. So when I did that, what I would do is I had all the passwords because every unit has like passcodes to the pantry and cleaning supply, utilities, all of that. So what I started to do was I keep my papers. So I kept it very organized. So whichever unit I was on, instead of being a burden and be like, hey, what's the password to the pantry? What's the password to the? And some of these people was like, I've seen you before. You just don't want to be a burden. Like I know I don't. So what I did was I kept all those papers. So when I go in and they say, "Hey, you're on this unit," I'll flip through my papers and be like, "Okay, so staff is this, the staff room is this password, the pantry is this, everything." So I'm just being independent. So I really, really, really hope that this helps because for me, I was so stressed out. My husband was like, he felt helpless because he could not help me because he didn't know what I was talking about. He's like, what are you talking about? I'm like, no, I feel like an idiot. I don't know what to do. He's like, but you were in training for a week. And I'm like, I was in training for a week, but they did not teach us what we're supposed to be doing. And honestly, it's probably like something that they're used to. Like, oh, she's new. She don't know what she's doing. But I'm just that type of person. Like, I want to do my job and I want to do it good. I do not want to just be like, oh, she don't know what she's doing. You know what I mean? I don't like that. So hopefully this helps. And you can just prepare yourself the day before. Look up YouTube videos. Find ways to be independent. If you're a nursing student or you're a nurse extern, you're already smart. So, you just use the tools that you have and you enhance them. That's my word of advice. And until next video, it's Freeman-Similien, SRN.